Thanks for joining us for Issues and Answers. I'm Ian Boyne. It's Vaccination Week, and Jamaica had the honor this year of having the director of the Pan American Health Organization, Dr. Carissa Etienne, launch this week. And it is our honor to have her in our studios on Issues and Answers. We thank you so much for your company. Dr. Etienne, good to have you in our studios.
Thank you so much for the opportunity.
Here. Vaccination, why is it important? There's still some resistance, not much, but some skepticism about vaccination. Why is it critically important?
Vaccination is important because it saves lives. Basically, millions of lives. It prevents really some major diseases, and we are able to administer it, not at no cost, but certainly within the investments in health, we are able to manage vaccinations. Over the years, we've been able to cover 95% of the population.
And Jamaica is not doing badly at all.
No, Jamaica is at 95%. There are now some 20 diseases that can be prevented from vaccination. And because of vaccination in the Americas, we've eliminated measles, we've eliminated polio, we've eliminated rubella and rubella congenital syndrome. Of course, smallpox was also eliminated. Mm-hmm. So these are diseases that don't occur here again. At all. And we were the first region to do this.
And measles occurred not too long ago in the United States.
And it is because of the vaccine hesitancy that certain population groups in the United States do not wish to be vaccinated, particularly with measles, mumps, rubella, because they claim that there might be a link with autism, and so they don't vaccinate. And so there were a number of children who were not immunized against measles, and so we got an outbreak there.
What's your response to this argument? It is gaining more and more currency that vaccination is connected to autism.
Well, there is no evidence of it. People have written in the social media about it, but there is no sound evidence.
So why is this the persistence of the suspicion?
Because those who feel strongly about it are very loud.
Yes.
And they write prolifically about it, and it resonates with some members of society. And frankly, with the celebrities, the more affluent types in the society. But also in the Caribbean, we've had some hesitancy from the Rastafarian movement. But
and some fundamentalist Christians too.
Yes. But you know, in a way, we've worked with these
Groups.
communities to help them accept immunization. I remember in Dominica, we had diphtheria in a child from a Rastafarian community. Now, diphtheria, we don't hear or see diphtheria, and we had to work with them and to get the kids immunized.
But PAHO is willing to work with various groups, to interact with them, to share the knowledge that it has with groups that might be hesitant.
Certainly, that's why the Secretariat exists, and we work with all of our member states with particular emphasis on those who are lagging behind. We help with procurement. We have the Vaccine Revolving Fund where we pool the demands from all of our member states and we negotiate prices. At one time, PAHO got the lowest price. We negotiated, we will only buy at the lowest price that you sell to anybody. And so that assisted a lot in making vaccines more affordable for many of our member states. We work with our member states to be able to decide on the demands, to forecast the demands. We give technical cooperation and guidance for actual vaccination programs. And we set up with member states the surveillance for ill effects and side effects of vaccines. So we are very, very involved.
Good. There are other health issues that we need to talk about when we come back from our break. We're speaking to the director of the Pan American Health Organization, Dr. Carissa Etienne.
Be vigilant. Keep yourself H1N1 free. Take a flu vaccine.
Stay away from sick persons or large crowds. Wash hands frequently with soap and water. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth, and cover your mouth when sneezing or coughing. Keep yourself H1N1 free. Your health is your responsibility.
Welcome back. We're speaking to the Director of the Pan American Health Organization, Dr. Carissa Etienne. The H1N1 Zika threat is of major concern in the region, and certainly in Jamaica. What's the PAHO's role in?
So let me separate the two. So
Yes.
let's talk about Zika. Zika emerged in Brazil sometime in May of last year. And since then, we've seen 35 countries in the Americas having active Zika transmission. Of course, you know, Zika is caused by transmitted through the Aedes aegypti, Aedes albopictus mosquito, which we have very high infestation rates in the region. And so we expect to see Zika taking root in many of our countries in the region. Normally, Zika is a mild infection, but in the Americas, we are seeing an increasing number of Guillain-Barré syndrome, which causes paralysis. Most people recover from this, but more importantly, it's the effect of in utero, the fetus, no? And we are seeing severe neurological deformities. The microcephalia is a sign of the damage that has been done to the brain. But it's not just microcephalia, it's a range of symptoms. Okay. And so we are seeing increased epilepsy, we are seeing eye problems, we are seeing irritability, and we are still documenting what are some of those effects. And PAHO is active in all of the countries. We have made some 28 missions to countries. We've strengthened their laboratory capacity, strengthened their surveillance capacity. We've worked on guidelines for managing both Guillain-Barré syndrome and the microcephaly and the neurological conditions in neonates. But as well, there are lots that we don't know. We don't know why Zika is causing so much microcephalia. At first, we had to establish that there was a connection. There was a causal relationship, which we have. So there is also a research agenda that PAHO has worked with other partners to define and to support that research. I think also it's what do you do about the mosquito? We've been fighting this particular mosquito for many years. It causes dengue, it transmitted chikungunya virus, and also now Zika. And in many of our countries, we have simultaneous transmission of Zika, of dengue, and of chikungunya. And we are now looking, and PAHO has said that it is available to accompany countries in piloting these innovative approaches to reducing the mosquito population. Okay. And that's another thing that we will be doing. H1N1. H1N1 is preventable. So there is a vaccine for H1N1, and some countries have gone on an approach of a blanketing immunization for all people. We recommend for countries where there is a budgetary issue that you do your targeted, right? Healthcare workers are susceptible, they're vulnerable, at-risk population, pregnant women, those who are immunocompromised, so we advocate for. The problem is that the vaccine is not 100% efficacious, right? So not everyone who first of all, if you take the vaccine, that does not mean that you will not catch the flu.
There's no guarantee.
No guarantee. But even though if you have the vaccine, the chances are if you catch the flu virus, then it won't become very significant, your illness. Because we see deaths with H1N1. But you know, we've also observed the vaccine hesitancy among healthcare workers. who are the most at-risk group,
Yes.
and they don't want to take the H1N1 vaccine.
Because they have concerns.
No, I think if you ask me, I think healthcare workers, we care less about ourselves. So most of us are afraid of injections.
That's a revelation. Dr. Etienne, primary health care. I know this is one area that you have put a lot of stress on. Why is primary health care so important?
Well, primary health care is important when it's organized properly and when it's done properly, in that it involves the community. It works in the community and with the community. It makes access to healthcare available right close to where people live. It is therefore more sensitive to their needs. It is more cost effective. To treat someone in a health center or health clinic is much cheaper than treating them in hospital for the same. It emphasizes prevention. It emphasizes comprehensive care. But I think also importantly, it's the community must get involved in defining and solving its same issues. And so it sort of presents that opportunity for communities to do this at their community. We found that there is, well, in 2006, I led the renewal of primary health care in the Americas, and did the same in Geneva some years later when I was the Assistant Director General there. And there is a significant movement now towards improving primary health care, and we see countries reorganizing their health systems with health clinics. But the important thing is you need to improve the ability of the health centers to resolve some more complex issues.
That's right.
So if you go to the health center and then you can't get your lab work done, you can't get an X-ray.
People are going to be forced to go to the hospital.
So they just bypass the health center.
Right.
But if you improve the technology there and you make it that people can go there and they are assured of getting care, that their waiting time is much less, then people will choose to go to their primary health care centers.
Finally, Director, universal access. There are countries like Jamaica challenged with their budgets. Why is universal access still important despite budgetary constraints?
Because, and I am a great advocate for universal health coverage and universal access to health. Frankly, I led the movement in Geneva, and when I came to PAHO, we got member states, and we've worked with member states, so we have a resolution. So all of the countries of this region are committed to universal health coverage and universal access to care. But you hit the nail on the head. How are you going to finance it? But the truth is that many countries in the world achieved universal access even when they were low middle income countries. So it is the political will. It is the will to say that we are going to either through taxation or either through national health insurance, that we are going to reduce paying at the point of service. So the worst thing that can happen is if cost is associated with care. So when you are ill and you have to go to a healthcare facility, if you need to pay, that is the biggest barrier to accessing care. So we have to look for mechanisms to pool those resources prior to, and people can contribute to that pooling. So resources are available for the health service. But importantly, there is always a percentage of the population that will not be able to pay. And governments have to be responsible for this.
Government must take responsibility
for this. Because we also associate this access to care with human rights. And this is enshrined in the WHO Constitution, in the PAHO Constitution, that people have the right to access for care.
Of course. yes.
And that's very, very important.
Absolutely. Also enshrined in United Nations
Exactly.
Charter.
And in many of our constitution, many countries in their constitution as well.
Absolutely right. Interesting talking with you, Dr. Carissa Etienne, Director of the Pan American Health Organization. We thank you for your company on Issues and Answers. Next week, we'll be back. Until then, Ian Bourne wishing you a pleasant day.